I'm a biochemist by education, and coming out of school, I went in human stem cell research around traumatic brain and spinal cord injury recovery and nervous system regeneration. So I've got a great background in cell signaling and neuroscience, but also after a number of years got that I wasn't going to go to medical school, so decided to look at what else was possible. Growing up in Boulder, Colorado, I had a natural inclination towards alternative medicine and plant science, so started looking in that area and got lucky enough to get a job at the beginning of the marijuana industry in doing hydroponic systems development and research, and helped bring a product called the Aero Garden to market, which is not in the marijuana space, it's a consumer product. It's a little kitchen countertop hydroponic garden, so I got to cut my teeth in product development and bringing products into the market on a global scale. That was kind of exciting, but
that really plays into the cannabis industry really well.
It absolutely does. And it was early enough in the industry that what we know now of growing systems and cultivation and fertilizers were just not as prevalent. So there was a lot of work to be done there, and I got a lot of consulting work because I was publishing in the hydroponics space. And that led me further and further into doing work in the cannabis space, including running one of the first large-scale CO2 extractors in Colorado, doing lots of early formulation before much was known about how to get good suspensions and mixes and blends. And so I've been at it for over 10 years now.
Wow. Okay, so there's a lot to CO2 versus ethanol extractions. Since you've been in the CO2 extraction, do you favor that type of extraction?
It depends on what your end product is. I actually would prefer cold ethanol above all other techniques.
And why is that?
Well, you end up in a solution that there's a process called winterization where you can remove contaminants and waxes. And CO2 extract, you often end up winterizing anyway, so you're already in that phase. Ethanol also pulls a broader spectrum of your natural terpenes and other flavonoids, so you get a broader spectrum of products that are interesting beyond the cannabinoids that also have medicinal value.
Okay, but the rage right now, or most companies right now, are CO2. I think CO2 and ethanol. What are the four different types of extraction methods?
There's butane or mixed gas, which are hydrocarbons, so butane, propane, stuff like that. That was favored for a while because it produced a lot of the products that people who like to smoke resins and stuff like that favored. CO2 has always been popular because it mimics more natural product science and extraction. I've done CO2 extraction outside of the marijuana space on other biomass like algae for carotenoids and things like that. So it's a process that I actually was familiar with beyond cannabis when I started working with it. There's cold ethanol, but super cold ethanol has just really made its mark in the industry. It's something that I had to tinker with for a long time to get to work well. And finally, there are people producing economic machines that work at the proper scale to do large-scale extraction with cold ethanol. So it's kind of a new kid on the block, if you will. Traditionally, people using ethanol had used warm ethanol or room temperature ethanol, and you get a less desirable product that way because you get more of the chlorophyll and interfering sugars and things like that in your extract, which are not fun to deal with and are really messy. So.
Now, what's one thing that's kind of shocked you about the cannabis industry since you've been in it?
There are so many things that have shocked me.
The list goes on and on.
I think the biggest thing that shocked me is kind of the duality of the conversation. Really, voters voted in cannabis in most states under the medical pretext or pretense. And many of the states have licensing and licensure bills around medical need for cannabis. But 90% of the industry's revenue is generated by recreational sales. So though that's not necessarily surprising, it's kind of shocking that there's just that duality to the conversation. It's kind of in some way, for me, being somebody a medical researcher and somebody who's published in the sciences, it made it hard to participate in it sometimes, because the reason I would be there would be pushing the science and for the medical benefit that was promised out of it. But a lot of the products that I've helped develop really don't play in that space. They're making gummies for people to take to a concert and have a good time and a good night, which is great. It's fine. That's what people like to do. it's just a dichotomy in the industry that I've found to be a bigger gap than I expected there to be.
What do you feel about how can we educate more scientists, more people in the medical field about the benefits of cannabis?
Right. Well, I believe you've spoken with Steve Odersberg, and he has such a huge background and capability to really describe what's going on in the endocannabinoid system and how it interfaces with all the different types of tissue and systems in our body. And just having people like that out in the industry speaking are a huge resource. Further than that is publishing and or getting information in the hands of doctors and physicians who are certainly experiencing cannabis through their patients, especially in states obviously that have legal cannabis. Patients are just finding cannabis as an alternative treatment post-recovery for cancer or just about any surgical recovery, etc. And I personally have spoken with enough physicians who wish they had known more or had better resources, and they just don't know where to point patients. And so there's a gap in getting the biochemical knowledge that we now have and is getting added to every day by research scientists and people who that's their focus, the pharmacokinetic side of any type of pharmacological products, if you will. And then the medical side of the industry, which still kind of has a hand up and says, well, no way, we don't really know it. There's not the clinical support behind it yet. So there's just a giant information gap there.
Do you feel like there should be recreation, just after saying that, do you feel like recreation adult use should be available in states?
Absolutely.
And medical?
Yeah, absolutely.
So how do you feel like those should be differentiated, the medical side versus the adult side? Do you have an opinion on that?
Well, why don't I start with how they should both be done similarly?
Great.
It's something that I think is just starting to come into play in the industry. And that's more professional production practices. So in nutraceuticals or in food, we have standard systems called GMP practices, which help producers produce a safer product with more consistency, etc. And so one of the basic tenets in that is that your testing matches up in such a way that you can accurately predict what your dosing of a product is. And so if you're in supplements or even drug manufacturer, you know that you want 100 milligrams of ibuprofen in a tablet that you sell over the counter at Walgreens. You have to achieve that within a certain threshold. But the cannabis industry has not really been held to those standards or has not had realistic testing resources available that actually support that. So we're just getting to a place where we're starting to have the infrastructure to do that. And so the accuracy and safety are a huge component, whether it's recreational or medicinal.
Absolutely.
If you don't know what you're getting, you don't know what you're getting. And we've all heard stories of somebody buying a brownie that says it's 100 milligrams and they eat the whole thing and they don't get anywhere, and an hour later they eat another one and it all catches up to them. And, so that's one facet. Another is just technologies that are starting to emerge as far as delivering cannabinoids into the body. One of the challenges is you can smoke it, you don't know what your dosage is, you can eat it, it takes a long time to onset, and there's a lot of variability based on what's in your stomach and your metabolism and your physiology. And so we're just starting to see the use of advanced technologies for bioavailability and delivery, so you can have an experience start to onset in 10 or 15 minutes instead of 45 minutes. The entire dosage gets into your system.
Well, dosing is a big thing because I have talked to a variety, and a lot of these podcasts you're listening to, we're all over the scale. I talked to several different scientists, and some will say 34 milligrams a day, some say no, it's 1 to 5 milligrams per kilogram that a person would need to take.
Right.
Specifically, I'm talking CBD here. I'm not adding the THC component here, but I just don't know if we have enough. I don't know if the data is not there. What are you telling are you ever guiding on dosing?
I don't. I certainly have in the past. And I'm somebody who, on the THC side, it's not something that agrees in my system at all, so I don't take it, and it's hard for me to tell somebody what the right amount would be because I have such a poor experience with it.
Okay.
But I have a sensitivity that from my research and learning with other people who understand biochemistry better than I do, I have a fairly unusual enzyme expression that just means that THC gets on top of me, and there's a certain number of people that have that who no matter how little they take, it's just not that much fun. On the other side, CBD I think is great. I get a great effect out of it. For me, 5 or 10 milligrams is more than enough.
A day?
Yeah.
Okay.
Upwards of 30, and I can actually start to feel some negative side effects. But most other people that I speak to, 30 milligrams is a great amount. So again, that sensitivity is there. So it's kind of hard for me to give good advice.
Well,
because my reference point.
It's such individualized care, like dosing care, and we're moving towards more of that in the healthcare system. We're moving towards a personalized, customized approach. Now understanding that the body, even though we're the same, we're not the same. Genetics has came into play.
Right.
And I know your company brings in the genetic component of things. Expand on that.
Sure. Well, we're working forwards on being able to utilize somebody's genetic profile that they could get through 23andMe or some other services that are out there. And through that, we're able to learn about the expression of a handful of different enzymes or other cofactors in our body that will allow us to say you're likely to have this type of interaction or not likely to have this type of an interaction. Can customize what and how somebody takes something. That's not my core area of expertise, really. That's what Steve does, and he does that really well. I love listening to him and talking to him because every time I do, I sit down and I learn something new about a field that I've been in for years. So.
What about formulating? That's where your specialty is,
yes,
correct?
Yeah.
Okay. What's that process like?
Sure. Well, when we start with the formulation, we always start with a conversation about what is the intended outcome or intended effect of a product, and what are the characteristics that that product needs to meet, i.e. sometimes it's about the delivery method, a capsule or a tablet versus a transdermal patch. Obviously deliver drug in a different way, and you're going to be addressing a particular condition. So you start with the condition and what the outcome is, and you kind of design from that standpoint. Sometimes you design to a market segment more than anything. So you look at where's a gap on the shelf in the supplement department of a natural food store, and kind of just look at what's already there and what opportunities are being missed. So there's a number of different ways we approach it.
It was funny because I just had a conversation with somebody in the space. A lot of people are saying that CBD is a nutritional supplement. Other people are saying no, it's under the DEA. It's a Scheduled 1. It's actually considered a drug because it's still under the DEA. How do you define that?
It's almost state by state in how you approach in the market. Currently, I would not label a product as containing 25 milligrams of CBD because of that federal scheduling. And the FDA, who regulates both drug and supplement products, is going to be looking for those label claims and looking for, when we say, when we're using a claim like 25 milligrams of CBD in a product or per dose, you're specifying a product that is Schedule 1 still. So, how the industry is handling it, the best legal advice that I've been given, so I'm trying to give you feedback just from my own memory from conversations with some attorneys, is that it's okay to label for a hemp extract or a phytocannabinoid-rich hemp extract, but when we specify a specific compound, we're treading into an area where that scheduling starts having an effect. And it's not currently recognized as a dietary supplement by the FDA, so there's an area there that we can also end up getting a warning letter just based on that fact. So phytocannabinoid-rich hemp extract, that's pretty ambiguous. You're not standardizing a specific dose to that, so we're not required then to have a label claim that requires test data to back up. That's almost impossible to get right now. So there's a number of ways that kind of connect in the background on that. And that's when I put on my quality assurance hat is, how do we get a label claim onto a package and be able to verify it with adequate testing that would support an FDA audit while not treading over into what is DEA territory.
Okay, so you're part of the formulation process. What type of companies are you working for? What type of companies do you want to work with?
Probably a really broad spectrum. I think the number one thing for us is the integrity of the vision, what a company is out to do and who they are in the marketplace, more than what kinds of products they make. And for us, it's just really about working with the right people who their intention is to do something positive and contribute to the world, rather than just make a land grab for cash, if you will, which is a problem in the industry right now. There's just so many people coming in trying to make as much money as quickly as possible, and there's a lot of really poor quality, low integrity products in the market. And we've seen that in supplements, we see that in natural foods. It's not an uncommon thing in growth. We work within a stage gate process, and so that's a process that's pretty standard for any product or process innovation in bigger industry. And the first gate is always a go-to-market analysis. And so we've broken that out in a way that we can offer that as an affordable package to help an entrepreneur or a small company or a startup that wants to bring a product to market really explore the space around that product and do a market analysis, do a workshop around what that product will look like, what it's going to cost, what the ingredient availability is, what infrastructure is going to be needed behind it, and then what resources they'll need to get into the market. So we can do that for, it's hard to quote numbers, but
Sure.
$25,000, $50,000, which is, it's a lot of money to some people, but that's really not a lot of money in the big picture for product development. And once we get to the end of that stage, we have a go-to-market plan for them. We have a budget. We know what it's going to cost to get into market and what the entire process will look like from there forward. So they really have a go or no-go tool. And they have a great tool for making the right decision. And even outside of working with this company, just as a consultant, I've helped an awful lot of entrepreneurs not start up companies and not pursue products, just getting very real and realistic about what it's actually going to take and understanding the market better.
What are you finding that people, when they're, what is the stop? What is the, why do they not move forward typically in your experience?
They may have had an idea that is a great idea, but the market's saturated. Or they may have an idea, it's a great idea, and it just costs far more than they imagined to actually get that product in the market. Or they may not have really understood what infrastructurally or team resources might be needed to do that. And so when they're faced with kind of that new information, it either can be challenging, and just more than they wanted to bite off. It might cost significantly more than they thought. That's unfortunately kind of a common occurrence in the entrepreneurial space. There's a myriad of reasons why.
Okay, so let's talk about the cannabis industry.
Sure.
As a whole, we have all these people that are starting up, that are wanting to be entrepreneurs, trying to get into the space. And, I've talked to several even different companies that are saying, no, you have to have big money to get into the cannabis space.
Right.
What's your thoughts on that?
Well, let's define the cannabis space. So if you're in the regulated marijuana space in states that have state laws for marijuana, specifically THC-containing products, generally that's become very expensive. Just the licensing and legal process alone can be upwards of $100,000 now. And that was not the case 6 or 8 years ago. You can get a license for $5,000, and kind of tinker with it, and it's just become a bigger money game at this point. In the hemp space and the CBD space, there's a lot of entrepreneurial opportunity because you don't have that same regulatory framework. You also don't have that same narrowness of market. So there's the ability to make, let's just call it theoretical product, a line of topicals or skincare products containing a hemp extract. And the market is more accessible because you don't have to have a license that transfers to another license in a regulated space. So it's easy enough just to find customers and sell your product. You can often find small contract manufacturers who will do small runs, and that's becoming more prevalent in the natural care, the natural product space, and especially in the hemp space. So there's a lot of nice small-scale resources that make it very viable, whereas even 5 years ago in the natural foods industry, for instance, it generally cost a lot of money to scale up and get into market because you had to have a large budget just to produce batches. So there's little pieces like that that have kind of fallen into place in the hemp space, and it's just a really entrepreneurial space right now. So if you can get a foothold with a product that you can do yourself and make it home and kind of do your market test within a smaller community and get that foothold, then that's going to be easy to take the next step. And there's a lot of investment money in the market available for that. So
yeah, we were just at MJ Business BizCon, and there was a lot of investors there. There was a lot of people there that are saying, "Hey, we want to help this industry move forward."
Yeah,
and which is really exciting. Which is really, really exciting.
It really is. I've been involved in one entity that is in fundraising cycle right now. They have been for 2 years. They're seeking a pretty large amount of money, and they've got a very noble cause behind what they're doing. But the conversation is just shifting. 2 years ago, it seemed like the money was there, but it wasn't. And now it's one conversation after another. So it feels like that dam is really breaking right now. So it's kind of interesting.
How do you want, for you, if you were to look into the future and if you were to have a kind of a glass ball and you were able to shape the future in the cannabis industry, what would you like that to look like?
You know, it's probably 2 to 3 different industries. One would be very similar to the natural care industry, where we see supplements and skincare products that we see in the supplement section and the skincare sections of
over the counter
Whole Foods.
Yeah.
Very over the counter, available online. You can order it easily, and those brands are out there, at a national scale. But there's always an entrepreneurial access to those markets, and there's always small startups. So that's a beautiful place for entrepreneurs and consumers.
Okay.
Another one is really that recreational space. People consuming THC for recreational purpose, and to me that should be regulated a little bit more like alcohol. Currently, it's regulated more like Schedule 1 or Schedule 2 drugs and heavy-duty painkillers. You don't have to have a doctor's prescription, but you sure do have to have a lot of paperwork in place to go buy and sell and transfer those products. So, it's something, dispensaries looking a little bit more like liquor stores, or even being able to sell products in the liquor channels makes sense to me.
Okay.
And then kind of last is just what's left with all the other industrial products from hemp and marijuana. There's so much available as far as protein sources, really good fats for nutrition, so just the ingredient side, the bulk whole supply side for hemp fiber, for paper, for fiber for clothing, things like that. And right now, because the states in the United States don't have consistent laws and framework, you really can't grow or produce those products in the U.S. and transfer them across state lines. So there's no basis for entrepreneurs to buy those commodities. They still have to buy them from Canada.
Do you feel like there needs to be a higher dose regulated? You know how like we have Tylenol, extra strength, and then or ibuprofen, and then you have prescription ibuprofen.
Right.
Do you feel that in this space at all there needs to be a really tightly regulated higher dosage of it, or
Interesting.
not?
That's a hard question to answer. In my mind, in my experience, I can't imagine taking even 100 milligrams of THC in a day. So, in really high doses of 1,000 milligrams and up, that can be so intoxicating to somebody that they could really end up in trouble. And you hear emergency room visits where people are in a panic. They're not likely to die from toxic interaction, but they're certainly in a panic. They feel terrible and they're going to be miserable for a few days. So it could make sense that there's a threshold of 100 milligrams for products, and that is the case in the recreational space in Colorado. In California, you can buy a bag of gummies. It's got 100 milligrams in it. It's got 10 pieces. Each one's 10 milligrams. It's hard to get in over your head with products like that. But you can also buy a gram of concentrate, which is 1,000 milligrams, and that starts being a lot if somebody decides to ingest it all. So.
Well, but there's people that are that are fighting disease or sickness, a real illness. And according to a couple of different pharmacists that I've talked to, they definitely would need that higher dose.
Yes.
They need that higher dose, and so I know there's lots of conversations out in the market of what that should be. So I'm trying to ask people what they think, and
part of my mind, says that that's what our original dispensary system was built up around in Colorado and California. The laws were tied to patient count. People had a medical card. The dispensaries were medically oriented. And in fairness to the entrepreneurs who forged that path and risked their necks to do that, I would love to see that piece of that infrastructure in place. But there's a lot of people who would really benefit from cannabis who are not going to go to a dispensary, especially in the elderly population, you know, and other populations, you know, even kind of the professional parent population. The dispensary is not a comfortable place, and so having access to a product in a pharmacy setting, and it's normalized, it's there on the shelf with 20 other natural products in the section of CVS, which has a whole like natural care section for colds. Why wouldn't we have natural products like that there, and then have a stronger dose available behind the counter? That makes the most sense, probably.
Yeah. Legends is all about helping other individuals take charge of their health, their mind, their beauty, you know, trying to have this contagious energy about them and freedom about them. You're in a place with the cannabis industry on your own. Now you're your own entrepreneur. You've started to do your own business and found partners, and you've kind of taken charge of that aspect. One, I guess I have the questions twofold. Why did you choose to take charge in the cannabis space? And how do you feel, because you've talked a little bit about your own self and taking charge of your own health, and hey, THC doesn't work for me.
Right.
How do people take charge of their own health in this space?
You know, I think the cannabis industry exists because of a desire in the public to take charge of their own health, and the beginning of the distrust of the pharmaceutical companies and big industry. And so the intention for medical marijuana to get on the ballots in the first place really is based upon that declaration that we have the right to be able to take charge of our own health. So for me, that's really the starting place of the industry. My relationship to it is that I've always taken natural products before going to a doctor or getting a prescription for something. And I guess being a biochemist who's had an interest in the space, I've been fortunate enough to not only find products and understand what I'm doing and use them, but also innovate and make my own products along the way. And that's always been a part of my world. So stepping into the entrepreneurial side of it and designing products with other businesses is just taking what I do well and having a vision and a commitment to anybody out there. I mentioned before, what's our ideal client? It's people who are trying to contribute to the world and kind of help set other people free. So to me, it's just linking back to that, and how do we, forge a real network of people in the world who that's their commitment to the world, and that's what they're up to.
I think it's absolutely beautiful. Is there anything else that you want to add to this?
The only thing I can think is just what a treat it is to meet people who are up to the same kind of thing like yourself. And, we all have a different story how we got here and why we're doing what we're doing. And we all have a different path forward with it. But there's a giant community and a giant network of people in the world who are taking charge of our own health. And there's something in the future for humanity in that's really important to me. We've given up too much of our freedom to big business and the big companies that are happy to sell us crap products all day long. And there's a potential for change inside of all of this.
I think it's a wonderful, because I think of just elevating your life, with nutraceuticals, within the cannabis space, with what you're doing with different lifestyle strategies and how you're implementing and taking care of yourself. I think it's a beautiful thing, and it's an honor to work with somebody that wants to help others elevate their lives as well. So thank you.
Yeah, well, thank you.
Yeah.